My name is Sliva, and I will be talking about my Educated Citizen portfolio for the BSN program, which I'll be graduating from in December of 2022. The public issue that I decided to discuss and further my education on was in regards to domestic and sexual violence. I wanted to choose this topic just because I feel as a future healthcare provider and future nurse, I need to be aware of these issues that are occurring in surrounding communities and in my community. And to be a more competent and holistic nurse, I think it is best practice to be aware. And if my patients were ever to present to my unit and I kind of recognized something was off or I recognized the signs of domestic and sexual violence, I would be best able to advocate for my patient and get them the help that I need. So I just gave a few statistics on this slide. The one that I wanted to talk about most was that domestic violence has been considered illegal in the United States for around 40 years. And then I proposed a question asking, is this really solving the issue? And then the last bullet point, I talked about how 1 in 3 women and 1 in 4 men have experienced some form of physical violence by an intimate partner on a typical day. The local domestic violence hotlines receive approximately 19,000 calls and approximately 13 calls every minute. So this statistic is just showing that this is still a pretty prevalent issue. The first educated citizen goal that I'm going to discuss is effective communicator. And the experience that I had that I can relate to this goal was having difficult communication and conversations with my family. My grandmother had a massive heart attack in 2019 and was hospitalized for this heart attack. And she was sent to Madonna for some rehab after her 2 week stay at the hospital. After her stent placement, she went to Madonna for some rehab just because she was in a hospital bed for quite some time. And after her rehab at Madonna, we noticed that she was kind of showing some signs of illness, and then she ended up having another and later found out that she did have went into cardiogenic shock and went septic from a staph infection that was growing after her stent placement. And she was out for about 20 minutes following this cardiac event, and doctors were telling my family, look, we aren't seeing much brain activity. She's not responding to the stimuli that we're using to test her brain activity, and we don't know if she's going to make it out of this. So I stepped in as having medical background from nursing school. I just kind of talked to my family and said the quality of life that my grandma's going to have, if we do try to keep her alive, isn't going to be an improved quality of life for her. We'll physically be able to be present with her, but we will not be able to communicate with her like we once did. So what I learned in this situation was how to really navigate those difficult conversations and remain professional when in hard situations. So I think I can really apply this to my public issue because this is definitely going to be a hard situation for me to navigate, especially my first couple situations that I'm dealing with. So knowing that I can still remain professional with my family lets me know that I will be able to remain professional with the victims of domestic and sexual violence when they are coming to me and needing a great patient advocate. The second experience that I would like to discuss for the effective communicator goal is being in a hostile environment that I've experienced with family members before and removing myself from this situation because it wasn't a positive situation for myself. And something that I learned a couple things about myself in this situation. I learned that body language can be more powerful than your own verbal communication, and that's something that I need to take note of. And acknowledging that I could personally be more transparent with my emotions and having empathy for others, I noticed that I could be more empathetic just because I didn't see their side, which I think made the environment more hostile, which is kind of why I removed myself from the situation, but I didn't necessarily see their side, which is something that I personally could improve on. And I did take note of that from communicating my experience as an effective communicator in this hostile environment. And then I also noticed that staying professional, mature, and nubile will get you much farther in communications and in life than being argumentative, because being negative isn't going to return with the positive. So, how I can apply this with my public issue is your patients that are coming in that are experiencing this violence are gonna want to know that they can trust you. And having awareness of my body language will really progress with these situations, because if my body language is open and I'm showing that they can communicate with me, it's showing that they're able to build that trust and rapport with me and talk to me about the situations, which will only help us progress farther in their care so that I can be a best patient advocate for them. And I think that's really important, especially with something that I'm so new to and they're so new to being open about. Having trust and rapport is really going to go a long way with these individuals. So, the second goal that I'm going to talk about with Educated Citizen is the reflective individual. So, the experience that I would like to talk about was when I had a clinical rotation at Madonna Rehabilitation in Lincoln, Nebraska, in the long term care unit. Many of these patients were traumatic brain injury and spinal cord patients that were there for long term care. And something that I learned, quite frankly, quickly also with myself was that the bias that I had in my head about why these patients were kept alive really needed to be deterred and looked at differently, because in my mind I'm thinking of a professional aspect. I'm thinking, why would the family want to keep these individuals alive? Same reason my family wanted to keep my grandma alive. They don't want their loved one to be away from them. They want them to be physically there with them. So that was one thing that I definitely learned right off the bat with this clinical rotation, was that my personal bias needs to be put aside, and this was a great way for me to learn this. And I also recognize that these patients need more competent and holistic care as they are adapting to these changes, not only in the long-term care side but more of the acute care side. These patients are learning how to adapt and overcome these new changes that they're experiencing in their life, whether that be from a stroke, a car accident, amputation. They're all learning how to overcome these changes. So I made a goal for myself with this Educated Citizen goal, reflective individual, that I need to look at situations in a more broad concept and evaluate the bigger picture, which also plays a part in the bias that I was experiencing. I need to look at the bigger picture of things, and that would be that the patients' families wanted to keep them alive because they need them physically with them. So, an application that I took from this that I could relate with my public issue is to never take life too seriously and be a major patient advocate. This is really important in domestic and sexual violence situations, because you could easily stereotype these individuals and have a bias about them. But if you're going to be caring for them, you really have to get rid of those biases and step aside and be more open and broad about their situation, and try to empathize with them and communicate with them, and really find the resources that they need, because really that's what they do need. And um, a lot of this has relationship with being a patient advocate, because that's truly what these individuals are going to need when they're opening up their communication to what's really happening in their life. So, the second experience that I wanted to talk about, that made me realize I'm a growing reflective individual, was navigating nursing school through COVID. This was definitely a major change in all of my cohorts, and my other friends that are in nursing school as well. This was a major change. We had to adapt to learning online and not having clinicals, and having to do online clinicals, and not really getting the one on one patient care that we really needed, especially as a new nursing student. So that was a definitely big thing that helped me realize that I can be a reflective individual, because I was able to adapt and overcome to this change, which is really important as a future nurse. You really need to learn how to adapt and overcome new situations, because it's nursing. You never know what is going to be presented to you. So, one thing that I did definitely learn was that being able to adapt to changes will make me a stronger nurse in the future, as sometimes you never really know what you're coming into. So, how I can apply this to my public issue is, um, being able to adapt to changes can benefit in conversations that are difficult with patients, as I may have never had to talk about these difficult things with them. And I can really be the patient advocate and educate them that change is scary, but sometimes it can be beneficial in the end. And I think that's important with these individuals that are going through this major change because it's going to be different for them. They're going to have all these resources that we present them with, and getting them away from what they've been so used to for months and years, and we're getting them out of these situations. So it's going to be a big change for them, but I personally would educate them that this change is going to benefit them greatly, and they're going to be safe, and they aren't going to have to worry about what's going to happen in the next hour, the next day, or what they're going to come home to, and that this change is really a positive change for them, which is going to be really important to educate with them. So the last and final goals I'm going to talk about educated citizen is the change agent. So the one experience that I had was educating my grandfather on his medication regimen and medical diagnosis. It was an assignment that we got instructed to do in one of my nursing courses. And I found that this was challenging in itself, but also rewarding because I was able to professionally teach my grandfather how to administer his diabetes medication, such as his insulin, and why it's important to check his blood glucose levels and check his carbs that he's maintaining, and all the things that go with having diabetes. And I learned that approaching new learning in an adaptive way for a patient understanding will be more positive in the long run and have a more long-term effect with my patients. So making sure that the resources I'm providing and to my patients are reliable and they're relevant for good possible learning outcomes. So I wanted to compare this with my public issue with how I could really bring awareness on this issue to the general public, as well as myself, my family, and the general public. So, using learning tools that people can easily read, relate to, and learn about is going to be a great tool to use to bring this awareness to the public, which I found would be important as I don't have much understanding with this issue just because personally I've never had to deal with this, very thankfully, but I know people that have. And just for the public that doesn't really understand this because they've never experienced it doesn't mean it's not happening. So I think that's why we need to be more aware and cognizant of what's happening. So I think having this education tools is really important. And then promoting trust and building rapport with the victims can really help best assist to find resources and address my patients' needs. So if I'm able to build that rapport and trust, like I stated previously in this presentation, can really help with them trusting me to give them the learning tools that they need to further on in their care and rehabilitation, basically, from this major change they're experiencing. The last discussion I'm going to talk about is how I've had gender bias. I grew up in a home where I was mostly around females, so it was really hard for me to work around male population. And I found that it was hard for me to learn from them, and it made me uncomfortable. But as I'm adapting as a new grad, potential future new grad, and as a nursing student, I've had to surround myself with more male professionals. And I've learned that it doesn't need to be stereotyped, and they're all just like me, and I can really learn from them. And I think it's really easy to stereotype domestic and sexual violence victims. And I presented this lovely chart as it shows that just no matter your race, your gender, you it can happen to anybody, and there's really no certain group or age or gender that domestic and sexual violence really targets. So becoming an educated citizen, my first nursing class, I will never forget our discussion about becoming an educated citizen. We talked about being a reflective individual, a change agent, and an effective communicator. And I was like, oh my goodness, what does this mean? How am I going to apply this with my future nursing career? But I really learned over my years at Nebraska Methodist College that this has really helped me to be more holistic and competent and compassionate. And I learned that I will really have a great future as a future healthcare professional and as my own personal background. And it has really grounded me for who I am and how I'll be as a future nurse. Thank you for listening.